Hello, and welcome to my presentation on full arch digital implant impressions. My name is Adam Hamilton, and today we're going to do a deep dive into the world of digital workflows for edentulous patients, which begins with what is the cornerstone of edentulous rehabilitation, the impression. Now, I'd like for you to picture this patient here who presents to you with 6 well osseointegrated dental implants. And let's think about the options, about how can we start to rehabilitate this patient. We all know the consequences of what happens if we start with a bad impression, which is issues with the fit of the framework that can lead to possible biological and mechanical consequences. But what we're going to go through today are some of the details about the accuracy of digital impressions. What I also want to go through is how does the scan pattern and some of the research that we developed to define how the scanning should actually occur for full arch impressions, as well as some techniques which I'd like to present on how to do a digital verification. This is a common thing that we typically would recommend for conventional impressions, but how do we adapt that for digital impression scenario? And also like to then round that off with the discussion on virtual articulation. And this is an important part to understand. How does a digital implant impression sit within the entire workflow of the edentulous rehabilitation? So let's begin here understanding the literature out there on digital implant impressions. And there is a growing number of clinical and also laboratory in vitro studies that assess the accuracy and precision of digital implant impressions. And there's 2 really common themes that we're finding in the majority of studies. One is that digital implant impressions, specifically for single implants or partially edentulous patients,